When we think a little bit about some of the barriers to kind of an active or a sexual kind of an active sexual life as you age, what are some of the most common barriers that people have?
In very late life, we talked about availability of a partner, but there are also changes in body image would be associated with aging, has an impact. Certainly, people may have had other illnesses that affect that. For instance, mastectomy for breast cancer has a profound impact on women's sexuality and change in body image. But of course, people might be dealing with arthritis and chronic pain, and other diseases of the heart or respiratory system, or even cognitive impairment that make sex and sexuality very different. We talked about some of those age-related changes in terms of decline in libido, but it takes longer to get going, and it might take then longer to get going again. So there are various changes that do have an impact on ability to have sex, and needs a bit more thought and maybe planning. Heart disease, diabetes, depression, some cancers all have an impact.
When we think a little bit about, if we go down the path of sexual dysfunction, what are some of the common medical conditions that are associated with sexual dysfunction that people should be aware of? Because they may think, oh, something's wrong, and maybe there is something wrong, and maybe they should actually go and get help. But
Yes.
What are some of those common things?
So coexisting medical conditions that we know have an impact would be heart disease, diabetes, depression, breast and prostate cancer, HIV, dementia, and incontinence. All are associated with sexual dysfunction in both men and women. So, there's, if you're dealing with other significant comorbidities, there may be a lack of interest per se. In fact, older women with heart disease said that they actually, apart from the problems of arousal and general discomfort, they also couldn't relax. There's this almost anticipatory, I'm not a well person, I really can't relax into this type of attitude problem. And likewise in men, heart disease affects sexual function and erectile function, as does diabetes.
So for some of these things, Adrian, is it possible to get help so you could relax, that you can be better? Absolutely
it is, yes. And again, it requires a healthy inquiring and some advocacy on the part of the individual.
Think a little bit about healthy aging.
And also don't forget that the treatments for those conditions can also have an adverse effect on sex and sexuality, particularly say antidepressants, awfully common prescribed agents which can cause sexual dysfunction. It's trying to find the one that doesn't make the sexual dysfunction worse and treats the depression that's important.